Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started. Welcome back to the Whole Health Podcast. Today, I'm very excited to be welcoming Corinne Bush, who is a CNS, so a fellow CNS. This is like right in my territory. She, importantly, is the CEO and co-founder of the American Nutrition Association. Her tenure as CEO is the culmination of her lifelong mission to help people live their healthiest lives with nutrition. Before becoming CEO, Corinne led ANA's nutrition science and education for almost a decade. As a certified nutrition specialist, CNS, she is an expert in personalized nutrition approaches to complex chronic disease and holds a master's of science in nutrition from Rutgers University. Prior to her work at the ANA, Corinne maintained a private practice and oversaw nutrition operations at a large compounding pharmacy and wellness center. As a co-founder of the ANA, she helped architect the personalized nutrition profession via the development and joining of distinct synergistic organizations. Together, this ANA family of organizations educates, certifies, advocates, and connects the nutrition ecosystem to enable nutrition literacy throughout healthcare and the public in service of ANA's vision of healthy people powered by nutrition. Welcome and thank you for being here, Corinne.
Thank you. I'm so pleased to be here with both of you today.
So I'm just going to dive right into the big elephant in the room, Corinne, which is personalized nutrition, because I think that most people don't necessarily know what a CNS is, but certainly don't understand the concept of personalized nutrition. So can you kick us off by helping us understand that better?
Sure. Well, one of the things that we've always said at the ANA, because it's the truth, is that nutrition is the single most important modifiable determinant of health. And with personalized nutrition, we can really go far beyond modifying disease to helping people live up to their individual health potential. That's what personalized nutrition is all about. And so it begins with a conversation with that person to understand a lot about where they're coming from, what they're faced with, just a very deep dive into their life up until now. So there's a certain kind of conversation that we lead our patients and clients through to really uncover where we would go with determining the best course of action for them. So it's a really deep dive into their lives and their experiences and their health concerns. And then from there, an expert personalized nutritionist can decide what type of assessment to do. So over the years, and I've been a CNS, it's my 30th year anniversary of being a CNS. So the credential was birthed in 1993, and I became a CNS in 1995. And thank goodness, because prior to that, I was really struggling to find a path to practice this kind of work. And so anyway, so from that, what I really wanted to say there was that a client will come in and they'll hand us, and Megan and Kelly, you probably have had experience with this too, hand us their metabolic panel from their annual physical. And, you know, it tells a little tiny bit of a story, but it doesn't tell the whole story. So based on what we learn about the person, and often we'll have their metabolic panel in front of us, we can then determine where to go with assessment. So do we need to do a really deep dive right away and start looking at microbiota through stool testing, or toxicity through urine testing, certainly lab testing with blood? Or sometimes it's just a matter of saying, you know, there's 5 more things I'd like you to have your doctor look at. And here are these 5 things. And more and more doctors are really willing to have that conversation with nutritionists, in my experience. And so that is the way that we develop an understanding of the person's health situation, and from there develop a personalized program. So it's the opposite of what was going on for the 80 years prior to that, before the advent of the profession, where we had like one size fits none guidelines, didn't we? And so they were just trying to fit square pegs into round holes, when really what was happening is that people are getting sicker and sicker and sicker. And so we're now faced with a chronic disease epidemic, the likes of which it's just a staggering place to be. But personalized nutrition can bring a person back in every area of their biochemistry and metabolic health, bring them back to really good health, and then optimizing health. And so that's a really exciting thing, and it's been my life's work. So it's just a pleasure to have this role and to be part of the ANA.
Well, as I always say, I can go on and on because I always have so many questions. So I'll keep going until you interrupt me. Okay. So I think, one of the things I find myself trying to articulate to people, and it can be kind of challenging, is we have these general nutrition guidelines, which, as you said, fit for virtually nobody, right? And then we have, a little more tailored nutrition guidelines. And then we go all the way to this personalized nutrition where we're trained to look at labs and understand biochemistry and really look at the individual person. But when you're looking at the different nutrition approaches, why would somebody want personalized nutrition? Like why does that improve upon their outcomes versus eat real food and generalized nutrition advice?
Yeah, it's because think of every individual and what they bring in terms of their uniqueness. And so eating more plants and, having good fat and all of that is great and is probably going to help. But when we come faced with folks that have, which is most of the clients that I've worked with, that have longstanding issues where they just don't feel good. People are so used to just not feeling like a thriving, vital individual, right? And so, I'm in my 7th decade of life, and it's rare that I see someone come to me and feels as good as I do, even if they're 35. And typically they come also, and sadly, with not one, not two, but more than that, of diagnosis codes and medications, and all of that really needs to be handled in a very expert way. So eating more plants is great, but it's not going to really transform an individual from feeling not their best to feeling their best, even if they're not sick. One thing that I love, and I'm sure you guys do too, is to be faced with someone who is healthy and wants to be their healthiest. And that's really a pleasure, isn't it? So,
what took you down this road? Why were you drawn into this profession?
So I was drawn into the profession because when I started out in school 30 plus years ago, there was no avenue for personalized nutrition. And I knew that I wanted to be a nutritionist. That was my dream, was to be a nutritionist, but there was no school that could teach you how to do that. So I went the route of dietetics, and I didn't become a registered dietitian. I got a first job in a nursing home. And I was on a tray line. I was supervising a tray line where the trays would go by, and you would see diabetic diet. Okay, yes, they have the Jell-O that has artificial sweetener Jell-O and a packet of Splenda, and then the next tray would come by, hypertension diet. They have the sugar substitute, and that was the level of individualization that was going on at that nursing home. And then the kind of food that these people were eating was just abysmal. So I would go home like in tears every night and saying to my husband, I just can't go back there. And then I got a call from Rutgers out of the blue saying, we're going to give you a full scholarship to get your master's in nutrition. And that was just from nowhere. So I did that, and I just kind of never looked back. I had the hubris of being, 23 years old. And so just started visiting doctors and saying, I have an approach that is really going to help your patients be healthy. And I met a doctor in my town, Dr. Chris Munson, and he and I formed an affiliation. And then I found the CNS certification. And so it all came together for me. That was a very difficult road 30 years ago. It didn't come together for a lot of people, as it did for me. So then about 15 years ago, I looked around and I said, there's got to be a way to make this happen across America. And so that's when I found the American Nutrition Association and started volunteering there on our certification board that you now serve on, Megan. So
yeah.
we've come full circle.
Why does that not surprise me?
Yeah, I am kind of following Corinne's path in a lot of ways, which is really
Sounds like
fascinating. Yeah.
Including the Jell-O.
Yeah, including the Jell-O. Well, I was going to say, it's so interesting. Well, I was sitting in my last term getting my undergrad in dietetics at Kansas State, and I'm just going to say it, at Kansas State. Come on, guys. And the head of the department said, well, if your patients get sick of the vanilla carnation instant breakfast, because one of the biggest problems with patients is repetition with their food. They need diversity. Flavor them with different Jell-O flavoring packets. So they can have lime one day and strawberry one day. And I about, lost my mind. I think my blood pressure went through the roof. And I just said, I can't do this. This is insane. But it is also interesting to me because you're talking 30 plus years ago, having this moment where you're like, Jell-O, this is insane. I have a candidate I'm supervising right now who works at a local hospital here in Portland, who's doing her doctorate, and she's on the tray line, and she shows up to our meetings and says, I'm barely surviving this. I can't believe what they're feeding people at a scientific teaching hospital that are suffering with obvious diagnoses. We know how to feed them, and we're still feeding them garbage. So it's amazing how far we've come, and yet it's amazing how far we haven't come. And that kind of leads me to my next question for you, which is, where is the gap here with medicine, healthcare providers, and all the research and evidence we have about personalized nutrition? Why is it not happening?
Yeah, why isn't it happening? Well, I think just to go back a little bit to what you were talking about, this profession is very, very new. So there was no personalized nutrition profession legally and formally until 2019 is when our team brought together 5 organizations so that you could have a real profession that has components to it. You need a certifying agency, you need a credentialing agency, you need a journal, a peer-reviewed journal, and you need an education arm. So it's very, very, very new. And it's hard for us who are just immersed in this to believe that the average healthcare professional has not gotten the memo, but the average healthcare professional sadly really needs the education. And so that's one of our strategies over the past number of years, is to embed personalized nutrition into the healthcare professions, because nutrition is for everyone. And I mean, not only every person as in the public, but it's for every single healthcare professional. And if we think about it, and this was Mike, our former CEO, who coined this idea that nutrition is really a singular healthcare thing, because it's both a profession and it's a tool. It's a tool that should be in the toolbox of every single healthcare professional. So that's been our thrust over the last 5 years. And we have made really good inroads. And Megan, you're familiar with this. But so training physicians and nurse practitioners and dentists and physicians associates and every single healthcare professional, so that when someone comes in, how often do we hear we give a patient a recommendation and bad enough that their doctor would say, gee, I don't know. I don't know. But instead they say, well, with your inflammatory bowel disease, your Crohn's disease, it really doesn't matter what you eat. So just, have your Jell-O and have a few different flavors, and that'll be the end of it.
Yeah.
I'm curious, to what extent, or maybe is it a part of the goal of your organization, to have a level of impact within medical and dental and nursing education?
Yeah. So we have a fantastic program that has gotten really, really good penetration in some avenues. One group that's taken this up a lot is a group of ophthalmologists and optometrists. And so, but we're bit by bit going into each of the professions. We've got a modular training of 44 continuing medical education hours. We have symposia, we have conferences and other kinds of education. So it's a big job, and that's our plan. So, and now we just heard about nutrition in medical school, so that remains to be seen what the uptake of that will be. But I'm really excited about presenting that plan at the medical school level. We do have our trainings within universities, not yet in medical schools, but that would be
That's exciting.
I had a conversation with one of my very close friends years ago while her husband was in medical school. And I said, he's lucky if he gets an elective, but he probably won't even get an elective. And she said, med school's long enough. I don't think I could tolerate the years it would take for him to understand nutrition too. And I thought, well, first of all, thank you, because yes, it's not one class, right? It is more extensive than that. But that's the point of collaboration between healthcare professionals, right? And what we're thinking about in our profession is really being able to work with all the other specialists and primary care providers and dentists, which, Kelly and I work so closely together, respecting each other's expertise, but knowing that we have our level of expertise as well, that is essential for people to actually heal and get better.
Yeah. And that's our concept of nutrition literacy. And so we coined that term to mean, there's health literacy, so it's not like literacy was a new thing, but in the nutrition realm, to mean that anywhere an individual finds themselves, whether they're going to their healthcare professional, or they're going to the supermarket or a vitamin store, they're going to be faced with people that have a level of understanding about the importance of nutrition and can, if not utilize it in practice, be able to say, you need an expert. And so there is such an expert, and that's a certified nutrition specialist. We would love to have people be more expert, and that's why we at ANA, we've done so much with legislation across the country, but we don't want to slam the door after we get in. We want to we create a big tent where everybody talks about nutrition to the level of their training. That's one of our major thrusts.
I would imagine. I would think. Tell me if I'm off base here, but I would think that the desire for people to enter into this arm of healthcare is growing?
Yes, we've seen that within our own cadre of certified nutrition specialists. And we see, I don't know if Megan and Kelly, you see this, just in the other practitioners that you're in contact with, but there's just so much interest. There's a growing level of interest and understanding that, hey, this stuff is important and it's, I'd like to know more about it too. So I do see that there's that, but we need exponential growth. That is without doubt. The incremental growth that we've seen over the last 5 or 6 years is not going to heal the whole of America. We need to have everybody talking about this. Hence the idea of spreading nutrition literacy as far and wide as
it's interesting thinking about the lack of nutrition literacy, but also how much potency it has when people do understand it. And, we talk a lot about how beneficial it would be if we had a CNS in the primary care office, right? If we had a CNS, maybe creating the meals in a hospital setting, and not necessarily does it always have to be a CNS, but paying attention to the fact that, yes, there's a foundation of eat real food, eat plants, right? We say that, just eat real food, right? That's probably going to make everybody feel a little bit better. That's not, easier said than done for a lot of people. Again, without the literacy, that can be hard. But the personalized aspect of this in a healthcare setting specifically, when you're thinking about that, how do you foresee that working on a greater scale in our healthcare model so people are able to access this type of nutrition care?
Yeah. Well, one thing that we've done in some of the forays that we've made into healthcare systems is help to develop assessment, simple assessment data points that can be added for every single person. That it should be a no-brainer that everybody that comes to your healthcare facility should have a vitamin D test and a fasting insulin and a hemoglobin A1C. But sadly, that is just not even the case. So there are small but very important things that could be happening in assessment that would really lead to changes in for patients that it's just not there yet. But we have done some work with healthcare systems to ensure that that's the case.
I think from our perspective, where we see so many people get better, right? But literally get better and heal when they have a personalized nutrition approach. It's almost, there's such a gap when we think about how little it's being used in medicine compared to its potency when it is used. And making those connections.
Yeah. That transformation, when that happens with a patient, there's just nothing like it. And I mean, how many times have we heard over the years, gee, I know what to do, but I just don't do it. And I was thinking about that, and I really think that a big part of that is if you have advice and it's advice that is really targeted to you and you feel the difference, you are going to do it. But when there's so much confusion, at realm, then it's really hard to have people stay with something because they just don't know which way to turn.
One of the trends that's happened in health, I think, or at least in our conversation around health, that I think helps support what we do is the recognition around women's midlife. And I think this is building more awareness around what we do in personalized nutrition because women are getting very loud saying, hey, what used to work for me does not work for me anymore. Why? Not it doesn't work for me, end of sentence, but why? And the more people are paying attention to things change in my body, symptoms change in my body, well-being changes, and the recipe doesn't stay the same, the more there's attention to the fact that we need to personalize our nutrition and lifestyle to ourselves throughout life, right? It's not one size fits all, and it's not even one size, or my recipe today works tomorrow, but that conversation's getting so loud. I've noticed so many people come in now and say, all right, all I eat is vegetables. Something's going on because I don't feel good and I don't this and I don't that. And I'm like, oh yeah, you're in a different phase of your life. And I think that is really supporting, you're hearing that too in your life, right?
Yeah, absolutely. Well, I'm hearing it also. I'm thinking about the relationships, the co-treatment relationships that we have, that the difference that I observe in the people who've chosen to work with Megan, and I've been a patient as well, so I've seen what does this look like when you sit down to have a conversation about what your understanding is for my own specific nutritional needs, what can I implement? People end up coming back to me as a clinician in a state of health that it's so easy to manage because they're doing, and I like that you said this, Corinne, when we started about the modifiable nature of nutrition, that you have personal choice over what you're going to put in your mouth and swallow and not. But to have a guidance that is done from the perspective of knowledge and good science makes such a difference in all, even in the dental health of the people that I see.
Yeah, talk about running a vitamin D when somebody is dealing with a dental crisis and their vitamin D is 12. It's like, good luck with that. That's not,
Right, yeah. And it does point back to awareness of, I was thinking too about if people knew that nutrition can talk about modifiable, it can modify your genes, right? It can turn off your genes of disarray and it can turn on your genes of health. And vitamin D is a great example of that because of the fact that it's a hormone. So there's just so much there. And the awareness is something that really is.
I don't know that
key.
The general consumer or patient or layperson understands, and certainly most people that come see me don't understand that I'm going to sit down with them. I'm going to look at all their medical labs. I'm going to look at their entire health history, their whole family history. I'm going to learn what I can about their genetics. I might run epigenetic testing. I might run stool testing, urine testing, look at hormones, look at, thyroid function. And yes, my general tool is nutrition to balance the body, right? But I'm not looking at a 3-day food diary and telling them what the next step is. And I don't think people understand how detailed and extensive and comprehensive our assessments are in the healthcare field until they've had a chance to work with us and realize, oh, we're literally looking under every rock to understand them. We are really
looking under the hood. Yeah. And I think the other message there is, though,
Yes,
sometimes it
true.
doesn't take all that, right, Megan? Isn't that true? And that's the other expertise that we bring, is that we understand what your needs are. Okay, let's start here. This is where the gold is probably of your situation. Let's start here, and then we can add more testing if it's needed, and often it is, because many times the kind of testing that you're talking about is completely indicated with a client where we're seeing the tip of the iceberg after 20 years of
Why
really
do you
bad
think
health.
there has been a challenge thus far for having CNSs in healthcare offices in the healthcare field? What is the gap?
Again, I think it's awareness of the individual that is running the show there. So when I went to work like 25 years ago at this compounding pharmacy, the fantastic place, and I put in all the nutrition and the assessment, all of the assessments and the supplement dispensary. So there was a registered dietitian there, and that person was doing like, well, here's your diabetic diet. Let's look in the manual, and then here's your diet for this and that. And so the whole thing just took off like an explosion in our community at that time. And it's still a thriving place. It's in Bedminster, New Jersey, the Far Hills Pharmacy, Integrative Pharmacy. And so I think those kinds of things can kind of light the fire once you make it happen. But it's, you need the right kind of doctor or dentist or whoever is running that practice to get the memo.
What does it take to become a certified nutrition specialist? What is that path?
So I do want to go back to one thing about licensure, which is that I was supervising a person 15 years ago who came to me and said, Corinne, do you know that there's a bill in New Jersey that, if passed, would preclude not only me, who spent $50,000 just now on a master's degree, but you too, I think, from practice? And I said, oh, no, that couldn't be true, Ginger, because, and now I'm going to tell you what we need to be certified nutrition specialists. Because as certified nutrition specialists, you have to have a specific curriculum in personalized nutrition in a master's or doctoral program. You need a 1,000-hour supervised experience under the tutelage of another CNS or personalized nutrition licensed practitioner. And then there's a rigorous exam that tests knowledge and skills. And then every 5 years, there's a recertification need of 75 continuing educational credits. So I said, Ginger, no, because dietitians have undergraduate degrees. So, and it's not in personalized nutrition. So we marched off to Trenton, and now there is going to be a law in New Jersey very shortly. And I think where you are too, that includes the CNS.
We've had to fight really hard to have licensure, and that allows us to practice something called medical nutrition therapy, which I think most people also don't know, don't understand the differentiation there. But a lot of people, our career is interesting because you could call yourself a nutritionist. You know some stuff. You drink fiber in the morning, so you're halfway there. But
Thank you for that.
You can call yourself a nutritionist if you like broccoli, right? And that's why it's important for patients or clients to understand that might be fine if you just want somebody to help you clean up your pantry. Go to a nutritionist that likes food. But if you need somebody to address your actual health, your biochemistry, your biology, your health outcomes, you are best served by somebody that understands biochemistry and biology and anatomy and physiology and has been supervised by somebody that does this and has taken a board exam, because you can actually get kind of messed up, as it turns out. Certain, this is my favorite story. I had somebody come to me who had worked with a nutritionist in Australia, and she owned a gym, and she was very physically active, and she was a woman at 50 years old, and she had had her thyroid taken out. And he put her on a carnivore diet and to lose weight, and told her, it's cool if you just eat fish and chicken breast, just have a little bit of berries. And by the time she came to me a year later, by the way, she hadn't lost a pound, and she felt horrible and she had lost half of her hair because, again, no thyroid. But she had scurvy, which is a severe depletion of vitamin C that we only think of as sailors getting because they had no access to citrus, right? But she had been put in a state of scurvy, whereas I would not choose a carnivore diet for her. But at no point was she educated that you have to eat organ meat and berries to get vitamin C and all the minerals you need, right? And so when, most people don't think nutrition can be dangerous, but with the wrong education, it can be really, really dangerous to your health to get bad advice and to be trusting in that advice. So there's definitely a big difference in somebody that has invested in their education and experience to be able to give that type of health advice.
Yeah. Well, I think the point too is that right now there's so many different titles, right? There are many, many, many different acronyms, and people are just like, oh, that's a nutritionist. They have these letters next to their name. So it's really important to understand more about that person that you're interested in working with and see what their actual level of expertise is. But you're right that medical nutrition therapy, which is nutrition for a diagnosed disease, is then cabined to CNSs or registered dietitians across the nation. And then the way that we have kind of brought these bills to the table and have insisted upon is that all others can talk about general nutrition and nutrition for good health, as you say. So health coaches and other health practitioners should be able to.
So for the sake of clarification, I just want to make sure I'm understanding this correctly. CNS, Certified Nutrition Specialist, that requires a master's degree or doctoral degree.
Yes.
So that's no joke. I mean, I have to share the experience that I had for probably starting 10 years ago. I was going out and taking naturopaths and acupuncturists, people out to lunch and trying to find somebody with whom I would form a connection. And it ultimately didn't happen until you were seeing a woman and I was seeing the same woman, but we didn't know of each other. And, I'd done some dental care for her, removed some implants to which she was allergic and taken out some dead infected teeth. And then once we connected and I came to understand what you did and how you did it, first of all, I'd never met anybody quite as passionate about their care as Megan here, but your sheer knowledge and understanding of what blood tests and the things that you all gather, how you can look through that lens to make personalized recommendations for somebody. It was very obvious to me within the first hour of our Pete's coffee together that this woman really knows her stuff, way better than most of the naturopaths I'd ever met. So it's no joke what you guys are doing. I mean, it's a lot of training, 1,000 hours. That's significant.
Yep.
Mm-hmm. Yeah. And I think almost to a person, every CNS I've ever met is a passionate person with the fire in their belly to heal. It's a real, it's a mission. And so I think Megan and I are lucky in that our personal missions align with the work that we do to the degree that that's, not always the case, but it's really a beautiful thing. So yeah, certified nutrition specialist is the expert in complex chronic disease. There is no other as far as.
Yeah. So let's say we have practitioners out there who are listening or people who are interested in engaging with a CNS, where would they best go to learn? Where is somebody with that skill set?
Yeah. Thank you. You can go to our website. There's lots of information there, which is theana.org. And if you have specific questions, I would address a specific email to education@theana.org, and we'll answer specific questions about the certification or point you to the information that we have. So that would be the best avenue to
if you
find
could
out more.
Have the ear of every person in this country right now and say one thing about nutrition, personalized nutrition, what have you, what would you say?
Well, as it turns out, we have a 1 hour modular, very, very easy, simple program. It's called Getting Started with Personalized Nutrition. I would take that program. And so you'll find it on our website. And we are also making available a handout on fiber as it turns out. And so to access that, you can, I have that right here because I asked Amy, what should I tell them? How can they get it? Oh, it's the ana.org/whole health podcast. And you can get that handout on fiber. So I noticed that your last chat was about fiber, Megan, the soluble fiber.
One of my things.
Yeah. I don't blame you for being obsessed, because what I love about soluble fiber is it's one of those recommendations that hits so many different things, right? From toxicity to insulin regulation, to hormone regulation, to microbiome health, to the brain,
top to
the health of the brain. So it's a really great topical conversation to have. And so please, I hope that the audience takes advantage of the handout that we have for you.
I want to thank you for being a pioneer in our field. It's not easy. And it has been your life's work to not only become expert as a healthcare provider, but really to bring our field further into the healthcare stratosphere. And hopefully, you've inspired all of us that have come after to really continue to work our way into healthcare because we have something special to offer, but also we need everybody else too, right? None of this the patient does not get what they need when this happens in isolation. The patient gets what they need when we are collaborating all together as providers. Kelly and I were on a call with a naturopath and an acupuncturist at 8 a.m. this morning doing a case study on a patient we're all trying to work on together. That's what our patients deserve. They deserve all of us collaborating together so we can bring them the best care. And I just really appreciate and respect everything you've done to grow our field, and that the ANA continues to support for all of us.
Thank you. And what I have to say is I thank both of you for being the type of collaborators that really spread the message, right? Because it is incumbent upon all of us who are really after health transformation to make those connections and make them work for it and for the folks that we're dealing with. So it's fantastic to see.
Well, thank you for being here, and I'm really excited to continue working with you. I feel very fortunate to have you in my sphere. So thanks, Corinne.
Me too.
Great to meet you too. Thank you so much.
You, Kelly.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.